Laparoscopic surgeries and hysteroscopic surgeries has played a big role in management of those patients who are having fertility problems. Since last invention of keyhole surgery in 2 to 3 decades time, more and more advanced equipment and instrumentation, camera and energy sources have come up, and that has made a keyhole surgery or laparoscopic surgery a very safe surgery. So fertility management has changed drastically, and thanks to laparoscopy. Common problem treated with a laparoscopic surgery is related to uterine fibroids, where fibroid is coming in the way in conception, or it can cause recurrent abortions. Similarly, few patients with bicornuate uterus, we can connect two horns of the uterus and laparoscopically we can restore the normal anatomy of the uterus. For tubal problems like tubal block, laparoscopic tuboplasty and adhesiolysis of the tubes have become the gold standard in restoring the fertility. Similarly, those patients who have ectopic pregnancies, laparoscopy is boon. Without damaging the tube, we can remove the ectopic in those early cases of tubal pregnancy. And thanks to sonography machine of high resolution, that these pregnancies are picked up very early stage. So patient saves the tube and can easily conceive again with the same tube. Many times because of the previous infections, there are some adhesions in the pelvic cavity, and that's why the tube also becomes adherent to some other organ and get kinked, and that can be the reason of infertility. So laparoscopy can help in removing those adhesions and restoring the tubal anatomy. For the case of ovary, there are certain causes which can lead to infertility, and among them the prominent is ovarian tumor or ovarian cyst. The simple cyst usually doesn't require surgery, but if it is 7 cm or more in size, it may not respond to the medical line of treatment, and hence laparoscopy saves the ovary and can easily remove the cyst. Similarly, ovarian tumor of benign nature, where there is no possibility of cancer, the tumor is removed and ovary fertility can be preserved. The most common findings and one of the important cause of infertility in young women is polycystic ovarian disease, which is in short called PCOD. PCOD has medical line of treatment for stimulating the ovary and creating a good ovulation, but some patients fail to get response from the medical line of treatment, and there the role of laparoscopy comes, whereby ovarian drilling can help the ovaries to restore its ovulating function with a good response to the hormonal management. Another common disease, which is known as endometriosis, is one of the important cause of infertility, and depending on the stage of the endometriosis, the diagnostic part in the staging of the disease as well as in the curative part in removing the disease, laparoscopy is gold standard. In laparoscopy, we cauterize the small endometrial deposits all around the pelvic peritoneum. Sometimes it is so adherent that a finer surgery is required. Many a times the ovaries are affected, leading to a condition called as a formation of chocolate cyst. This chocolate cyst can easily be removed with the help of laparoscopic advanced treatment. Thus, endometriotic patient, laparoscopy is gold standard. Lastly, laparoscopy can also help in understanding the tubal patency, which is routinely done as a diagnostic procedure along with the laparoscopy, whereby the quality of patency and the quality of fibrillar end of the tube can be very well studied. Thus, to summarize, laparoscopy has revolutionized the treatment of infertility and helped many patients for restoring the fertility, and they are blessed with the children. In my 30 years of the practice, I have trained myself as an endoscopic surgeon with advanced training from Germany, USA, China, Singapore and UK. And that has helped me to acquire a lot of good knowledge of fertility preserving surgery. And in Parak Hospital, we all have advanced equipment to manage such cases, and with complementary to our management, we have very good IVF department. Thus, our patients are coming far from many sides of the Bombay in the country, as well as some overseas patients also come, and with the dual combination of endoscopic surgery and IVF, we get very good results.